the concept of co-production is actually pretty simple. It comes originally from economic theory and has been described by social scientists in many fields: political science, sociology, business, public administration. It starts really with the notion that producing goods is different than producing services. This is a fourth grade social studies concept. There are a variety of ways in which producing goods is different than producing services. But most importantly for our purposes, goods are produced by some sort of manufacturing process that's actually independent of the consumer. So a good manufacturing process might include market research and might design its product based on an understanding of the consumer's needs and desires, but the actual manufacturing process is independent of the consumer. In healthcare service, however, health outcomes that are created are necessarily co-created. So my doctor might prescribe me a pill, but I have to fill the script and take the medicine. My doctor might be able to help me understand what's causing my nausea, but I have to get in touch with her somehow, and I have to explain what's going on in a way that she understands. So in some ways, the idea is as plain as the nose on your face, that health outcomes, both good and bad, are not created by health professionals or by the healthcare system, acting independently, but they're always co-created with patients. So, of course, the degree to which patients and health professionals are true partners in this work varies quite a bit. So in the primary care clinic, when we're focused on managing my diabetes, I have quite a bit of agency about what and how much I eat and how I will exercise and how often I'll check my blood sugar. In the operating room, when I'm having my appendix removed, I'm anesthetized, and most of the agency belongs to the members of my surgical team. But as soon as I come to without my appendix in the PACU, I start to reclaim some of my agency. People are very different from each other too, of course, in so many ways. They differ in their capacity and their desire to assume an active role in creating these health outcomes. I work in a safety net system that cares for many people for whom it might actually be pretty radical to imagine that they have an important role to play in creating their health outcomes. If you imagine that blue is patient agency and green is health professional agency, you can play with the shapes over time to imagine the way in which the agency and the dynamics of the partnership might change over time or in different situations. But the fact remains that health outcomes are always, to some degree, co-created by patients and families working together. So as simple as this idea is, it's actually really not the dominant culture within healthcare. My dad actually spotted this billboard in Minneapolis, which shows a pregnant woman with her hand on her belly. And the text says, "We can handle everything except naming your baby." It's an advertisement for the maternity services at the Masonic Children's Hospital. And as anyone who has ever had a baby or loved someone who had a baby, you know what a preposterous promise this actually is. I believe that the dominant culture within healthcare continues to be sort of this notion that value is created by health professionals and somehow pushed to consumers. I suspect it might be closer to the truth to see healthcare value as something that is largely created by people seeking well-being, somehow pulling assistance from health professionals. In the article that my co-authors and I published in September, we drew a conceptual model that sort of describes this idea about co-production, and it puts in the center the relationship between patients and health professionals with varying degrees of partnership in that relationship. But this relationship sits within the healthcare system, which sits within the wider community. And one of the things I like about the picture is that it sort of suggests different places where if you wanted to improve the quality of the partnership, you might focus your efforts. You could focus on the behaviors and the dispositions of patients and professionals, or you could focus at the level of the system itself, trying to do things that might enhance the capacity of patients and professionals to partner together. So for me, this idea has been like a new pair of glasses that allows me to see what happens every day in healthcare in new ways. I believe that this framework has important implications that many, many people are already working on, whether or not they use the term co-production to describe what they're doing. So I see it when I see efforts to improve patient health professional communication and making health professionals into better listeners. I see it when I look at efforts to empower patients to speak up and ask questions. I see it when I see efforts to measure patient experience and turn it into something that matters to both health professionals and the health system. I see it when the health system tries to improve and diversify ways to allow patients to access the health system with same-day appointments and electronic visits and group visits. I see it when I see patient-family advisory councils giving guidance to systems trying to be more responsive to patients, or in informal networks of patients like the Cambridge-based Patients Like Me phenomenon. So I guess I would say that sometimes our efforts within the healthcare system to be better partners with our patients look a little bit like the efforts of manufacturers trying to get customer input into furniture design. So the nuance here is recognizing that whether we intentionally work to improve the partnership or not, our outcomes in healthcare are always co-produced. And recognizing that has changed the way that I care for patients every day and has changed the way I started thinking about how to make care better in our system.
Okay, thank you so much, Maren.